Welcome to today's Rate Fast Speed Seminar series on carpal tunnel syndrome. I'm Dr. John Alchemy. Thank you for joining us. To get started, let's define what the carpal tunnel is. The carpal tunnel is a tunnel formed of tissue and bone in the wrist that allows the tendons and the nerve to travel from the upper arm down into the hand. Normally, this tunnel can only accommodate a fixed size and number of contents, so when the tendons and or nerves start to swell, these structures get pressure on them because the carpal tunnel cannot expand. The cause of carpal tunnel can be many. One cause is repetitive hand forceful use, and this causes swelling in the carpal tunnel and puts pressure on the nerve. The nerve in the carpal tunnel that causes the symptoms is known as the median nerve. Other causes of carpal tunnel may include thyroid disorders, diabetes, or changes in fluid state, such as heart failure or pregnancy. Once a person gets carpal tunnel, what are the symptoms? The symptoms are commonly early in onset and they may feel just numbness and tingling. As the condition progresses and the nerve has more pressure applied, then weakness and other hand issues can occur, such as muscle loss, what we call atrophy. It's important to understand that the treatment for carpal tunnel does not always include surgery. An assessment is made typically with a clinical exam. Sensory exam is carried out either with monofilament or two-point testing. And if appropriate, a nerve conduction test is done to identify the level of damage to the median nerve, such as how much sensory loss has occurred and how much motor loss has occurred. Stage treatment options may include simply the applying of a splint and hand exercises, all the way up to a cortisone injection and or surgery. Again, the level of intervention depends on the severity of the symptoms and their progression. Now a little nerd knowledge. Nerves are important for passing messages from the spinal cord down into the muscles, telling them what to do and how to contract. They also conduct information from the skin and fingertips back to the spinal cord, so we know if we're touching something hot or cold, sharp or dull, or one or 2 points. As mentioned earlier, carpal tunnel can be caused by workplace activities, usually forceful flexion hand activities, but also pregnancies, wrist fractures, and endocrine conditions, as we said before, diabetes, thyroid, etc. It's important to note here that if a patient is being treated for carpal tunnel, other sources of carpal tunnel should be explored, because if they are not understood that the employee has an unknown diagnosis of diabetes or a thyroid condition, treatment may be ineffective or suboptimal. Now let's do problem solving. An employee reveals that he has had some hand tingling that comes and goes for the past several months. These symptoms wake him up once every 3 nights, at which time he simply stretches his hands and goes back to sleep. He's had health plan screening for diabetes and thyroid condition in the last 6 months, and they were normal. He denies any weakness or progression of symptoms at this time. None of his AMA Guides 5th edition ADLs are disturbed at this time. Here's the question: does this patient need surgery for his carpal tunnel syndrome? The immediate answer is no. His clinical symptoms are minor and stable, and he has not had any functional loss from the symptoms at this time. Reasonable treatment would be a trial of splints and or a course of injections with hand therapy. If this fails or the symptoms progress, then the provider could consider doing nerve conduction studies and or referral to a hand surgeon for a second opinion. Thank you for joining us today for the Rate Fast Speed Seminar on Carpal Tunnel Syndrome. To learn more, please join us at rate-fast.com and go to our educational blog. Thank you.